This is Michael Oleski, and today's topic is ELDOA. Specifically, what is ELDOA and how can it benefit you? Now, before I answer that first question, what is ELDOA? Let me ask you this. Would you benefit from any of these body-mind improvements? Normalized disc bulges, reduced degrees of scoliosis, delayed disc degeneration, reduced joint inflammation and arthritis, reduced stress levels, normalized visceral function, improved posture, relief of chronic or acute back and shoulder pain, reduced forward head posture, even improved awareness and overall sense of well-being. And for you athletes, we can also add improved recovery time, enhanced injury recovery and prevention, increased flexibility, and improved muscle performance. Now, what if I told you that by integrating 20 to 30 minutes of ELDOA into your daily routine, you can either experience any of these benefits, or you could in fact prevent some unwanted events from occurring in the first place. Imagine how you will feel, how your performance will change, how your quality of life will change and change for the better. So hopefully I have your attention. So back to that original question, what is ELDOA? Well, ELDOA was developed by a French osteopath, Guy Voyer. ELDOA is both the name of the method and the postures. ELDOA is an acronym for French words, which translating to English means longitudinal, osteoarticular decoaptation stretches. Osteoarticular meaning bones and joints, decoaptation meaning opening. So each ELDOA posture is designed to create space within a precise joint or segment of the spine using myofascial tension and muscular contraction. And yes, you heard that right. ELDOAs can literally create space between joints. An increased space within a joint can lead to an improvement in joint mechanics, increased blood flow, reduced pressure on discs, reductions in pain, spinal disc hydration, improved posture, and sense of well-being and awareness. Sounds familiar, but it's worth repeating. And it sounds too good to be true, right? I mean, let's consider this example. These two x-ray scans are of a woman suffering, or I should say was suffering, from sciatica and lumbar pain. She's currently pain-free. The after image was taken 1 year after integrating ELDOAs into her routine. And you can clearly see an increase in space between the L5-S1 vertebra. This is where the pain was coming from. I mean, this is huge. Spending maybe 30 minutes a day and not only reducing pain, but also alleviating the cause of the pain. No surgical intervention, no muscle relaxers or addictive painkillers. I mean, back pain is universally a huge health concern. It's very expensive to deal with and very stressful on the individual manifesting it. Back pain is the most common reason people go to the doctor and miss work, according to the Mayo Clinic. Back pain is also the leading cause of disability worldwide, and over 80% of all Americans will experience some form of back pain in their lifetime. And when I'm talking about back pain, I'm not talking about some tension or tightness. I'm referring to a variety of possible problems, including pathologies of the intervertebral discs, painful sciatica, nerve root impingement, degenerative conditions of the spine, including the formation of bone spurs, and osteoarthritis, where cartilage wears away, allowing bone-on-bone contact within a joint. While most incidences of back pain do respond well to non-surgical interventions, it is common for pain and discomfort to persist. And the chronic use of painkillers and muscle relaxers have their own host of negative and unwanted consequences. It's estimated that half of all people that suffer an episode of low back pain will have a recurrent episode within a year. ELDOAs can break this cycle. They offer a paradigm shift in both acute and preventative care. Here's a study published in the Journal of Ripa College of Rehabilitation Sciences in 2016. They looked at patients who had a diagnosis of disc protrusion on MRI and non-traumatic disc protrusion. Major symptoms were pain, spasm, and muscle weakness. not unusual symptoms. Baselines were taken, appropriate ELDOAs taught, and they were reassessed in 6 months. The intensity and frequency of pain was reduced by statistically significant amounts. The conclusion was as follows, and I quote, "The ELDOA exercises improve the pain and functional level in the spinal disc protrusion patients." I mean, with regards to back pain, there's definitely a need for ELDOAs, but ELDOAs go far beyond just the pain. ELDOAs also exist for joints of the hips, ribs, shoulders, and skull. This image is the coxofemoral and external rotation ELDOA. It's designed to open the hip joint. I mean, there's tremendous amount of benefit from performing daily ELDOAs, especially for the athlete that places their body under much stress on an almost daily basis. ELDOA postures may resemble some yoga poses, but that's the only similarity. Where yoga focuses on stretching and gaining flexibility by elongating a muscle, ELDOAs work through tension and muscle contraction. ELDOAs work with the fascia. There are practitioners and modalities that work to manipulate fascia, but that work is typically static in nature. ELDOAs work with the muscles and the fascia in a dynamic way, a way involving movement, and that movement makes a world of difference. Fascia refers to a form of connective tissue that envelops and infiltrates all the tissues, organs, and structures of the human body. This includes muscles, vessels, nerves, and joints. In simple terms, fascia is the link between all the structures of the body, making the body a global structure, a single connected organism. Fascia is the skin of that structure that gives it its shape and structural integrity. Without fascia, we would literally be a meat bag. Without the fascia, the body would be incapable of standing up, much less move with any degree of control. Fascia works its magic through tensegrity. Normally, tensegrity would be its own topic, but it is relevant to this discussion, plus, well, I mentioned it. So this octahedron model is tensegrity in action. The dowels represent the bones and muscles. The bands represent the fascia. The bones are connected directly by the fascia, yet no two bones come in physical contact with each other. I can deform the structure by applying force, and what you see is the force gets distributed globally throughout the structure, just like in the body. Remove the force and the structure returns to its original state. So tensegrity is what allows this structure to maintain its shape, to stand up on its own and withstand external forces being applied. I mean, this is a complex topic. I mean, this description at best merely scratches the surface. If you want to learn more, consider exploring biotensegrity. It's the study of how tensegrity manifests in biological systems, from cells to tissues to whole organisms. I mean, it truly is amazing. So for most sports and activities, rotation is very important. Most rotation occurs or should occur at the joint T8, T9 of the thoracic spine. If this joint is restricted or stuck, full or optimal rotation won't occur. This may also create inflammation, irritation, and be a catalyst for injury elsewhere as the body tries to compensate. So this T8, T9 posture is considered the sportsman's ELDOA. Performed properly, using tensegrity, the positioning of the body, specifically the upper and lower torsos, and tension created by muscle contraction, we can both fixate the T9 vertebra from below while creating a lifting effect or creating space at T8. So additional space can be formed between those two joints. With repetition daily, this space can become the new postural position of the spine. Full joint mobility can be restored, and most important, utilized within your sport or activity. So the space between joints is not only important when it comes to movement, it's also vital to our health. This space allows for the proper functioning of the nervous system, the most important means of communication between the brain and all aspects of the body. If a nerve is physically compromised, for example compressed, even by a minuscule amount of pressure, nerve signals are impeded. While some communication gets through, the transmission rate suffers. The message may be jumbled and dysfunction manifests. Whatever tissue, including muscles, glands, or organs, innervated by that nerve can experience a decrease in function. Think about that. Communication between the brain and the body can be compromised through pressure placed on nerves along the spine or as they exit the spine. Can this contribute to current unresolved health challenges? Oh, you bet it can. A lack of communication can easily impair adrenal function, thyroid function, digestive function, liver function, and so much more. If the nerve innervating with a particular muscle or group of muscles is compromised, don't expect to be able to perform at optimal levels regardless of how you train, what you eat, or what visualization technique you employ. And I admit, I am personally performing ELDOAs on a daily basis. I use them with clients, and so far with great success. So who else employs ELDOAs? Well, within the ELDOA courses I've taken so far, there were personal trainers, massage therapists, chiropractors, even medical doctors present. What each of us have in common is the ability to recognize the benefit that ELDOAs can have on everyone. We also have ELDOAs being used within professional sports. Bryce Turner, trainer to the NFL's Kansas City Chiefs, uses ELDOA with his athletes. ELDOAs are showing up in the NBA, PGA, Olympic skating, and swimming, rugby, and more. Vancouver Canucks strength and conditioning coach Roger Takahashi has their goalie Corey Schneider integrating ELDOAs into his routine. Any participant of any activity or sport can benefit from ELDOAs. ELDOAs improve function, alignment, and stability of joints. This, along with appropriate training program, will improve how you move. And if you move better, you will perform better. Your risk of injury goes down. The ability to recover increases, all while longevity within your sport or activity increases in duration. Best of all, once you learn how to properly perform ELDOAs, you can do them yourself anywhere, anytime. You don't need any special equipment. All you require is someone competent to teach you ELDOAs in the first place. So most people would benefit from participating in a group ELDOA class. Others that have health challenges, especially spinal issues, or they place themselves under great physical stress on a regular basis, would most likely benefit first from an assessment and some initial one-on-one ELDOA coaching. There do exist lots of fads within the fitness and wellness industries. ELDOA is most definitely not a fad. ELDOA will be around for a very long time. I'd like to finish up by saying if you live in or near Phoenixville, Pennsylvania, a western suburb of Philadelphia, and you're interested in learning more or participating in a group ELDOA class or one-on-one training, visit me at odleskipersonaltraining.com. So I want to say thank you for taking time out of your busy day to watch, to listen to this information. And I do hope to hear from you. In the meantime, thank you again. Have a great remainder of your day.